midnight oil to give hope to men, women and children who survived the long Somali civil war. In this facility, one patient narrates how she lost all her 5 family members in an explosion, as another can't cope with the disappearance of her 3 brothers to the same war. As tears freely flowed down her cheeks, the doctors told us that there are many more patients who are suffering from post-traumatic stress disorders and are in dire need of treatment.
She's a patient with post-traumatic stress disorder, and also she developed complications like hypertension and diabetes. She is alone. She remained only herself from a family of 6. The 5 brothers died. The mother died also. She came here as wounded. She has been referred to Nairobi, and she died here in Nairobi. Now she's alone. We treated her before even she was not able to communicate. Now, as you can see, she is much better. But whenever something reminds her about in her past, she has these crying spells. She's not the only one. The PTSD prevalence in Italy is so high that it's unbelievable sometimes. And now we have also a branch, Africa Mental Health Somalia. There are 3 autonomous regions where also Africa Mental Health is helping. It is the only, I can tell you, organization which is helping really helping the people suffering here through training. For example, me and Dr. Mamula, we have been trained in the University of Nairobi and by Professor Ndete, who is the head of Africa Mental Health.
In the same breath, African Mental Health Foundation played a leading role in debriefing and counseling families of victims of the 1998 Nairobi bomb blast cope with the tragedy. Likewise, the year 2008 saw the AMHF staff members spend days on end providing mental health interventions to children and adolescents who experienced traumatic events during the chaotic 2007 post-election violence in Kibera. African Mental Health Foundation has also made other achievements in publishing many books, contributing in journals, and releasing reports on hospital-based studies, community-based studies, school-based, post-disaster studies, drug-related studies, surveys on disabilities, among others.
We've written several books, and we're in the process of writing several books, and it's a place where I think a lot of mental health work is being done, particularly in the area of research.
I started coming here as a postdoctoral fellow in 2008 and have been doing research projects with Professor David Ndete and the fellows at the Africa Mental Health Foundation for the past 3 years. We're running a research project here at the Kangemi Health Center where we're testing the prevalence of mental health problems as well as alcohol use disorders amongst people who come in for voluntary counseling and testing for HIV.
In spite of these achievements, African Mental Health Foundation has faced a myriad of challenges in the course of executing its mandate. Being in Africa, most patients suffering from conditions like schizophrenia, epilepsy, bipolar disorder, depression, anxiety, and sometimes just mild stress would prefer to visit traditional healers, witch doctors as opposed to conventional clinicians for treatable conditions. This traditional belief has resulted in many deaths, especially in villages where witchcraft thrives. However, these traditional and faith healers have started referring some of their patients to the health facilities.
Tunaendana na wakatupia ndawa na tukarudi na nilionyeshwa nimeiva na hizo ndawa mimi naamini nikikunywa kama simangamangi nitapoa, lakini kimangamanga siwezi kupoa.
Nilikuwa nimeona hiyo shida yake, alikuwa anaanguka hiyo ya ugonjwa, alikuwa na ugonjwa akili pia, na pia akianguka si ile epilepsy tunaweza sema hii ni kifafa, anaanguka tu, hatoi povu. Nikaona hii shida yake si ya kumalizia hapa, ndio nikampatia nikamtuma Kagemi.
Kazi yangu ni kuombea wagonjwa, na pia wengine wanataka tu tuendelee na maombi, lakini kuna wengine na washauri maombi na dawa pia. Sasa huwa na warifal wanakuja hapa Kangemi Health Center, wanatibiwa, pate madawa.
The other key challenge is alcohol and substance abuse that has clocked fever pitch. Right from men across women to children, alcoholism has become a serious problem in the Kenyan society.
Hiyo ningeweza kwanza ningeshukuru serikali ya Kenya ile nafasi ambayo alipeana watu wawe na kunywa pombe baada ya kazi kama kuanzia saa 11 na mambo kama haya. Ile pombe ambayo si halali, have enough personnel wale wanahudumia hiyo kazi, na mahali tunasikia iko hiyo pombe inauzwa, watu wanashikwa, they are being apprehended and then they are being taken to court.
In conjunction with the alcohol use disorders, we find high prevalence of other mental problems: depression, anxiety, thoughts of suicide, even suicide attempts, in which we give counseling. The same clinical psychologists see people not just for their alcohol use problems, but they counsel them and they provide psychological treatment for these individuals.
The Africa Mental Health Foundation, which believes that in the near future it will have presence across the country, is appealing to all partners of goodwill who have an interest in mental health to come on board and work together to finally bring hope for mental health to all in Africa.
The next 10 years or so, every Kenyan should have access to available, appropriate, affordable mental health services, and this is the philosophy of African Mental Health Foundation.